Thank you everyone for coming today. We are so happy to have you all here, and it's such a great turnout. We are talking about the Comprehensive Contraception Coverage Act and an extended supply of birth control. So I am Jenna Bimby, the co-executive director of the New York Birth Control Access Project, where we work to pass and implement laws and work with young people for advocacy across the state. In terms of extended supply of birth control, this allows pharmacists to dispense 12 months of birth control all at one time, fully covered by insurance. I'll have Dr. Sarah Lynch talk a little bit more about the ins and outs of that. And with that, I want to introduce Dr. Sarah Lynch and Dr. Joshua Steinberg, who are with us today and have been instrumental in getting this work done and supporting us as we do it. So with that, Dr. Lynch, I'm going to hand it over to you.
Thank you so much. And I want to thank New York Birth Control Access Project for all that they have done for pharmacists' ability to work with reproductive health in general in New York State, birth control access. They've been a great resource as well as great advocates for all of those areas above. So they've done a lot for us. I also want to thank Dr. Steinberg for being on today. He and I have worked together on many projects related to reproductive health here in the Binghamton, Broome County area for a while. And he's been a willing participant in many of the projects, including the one that we're going to talk about today. So he's going to share a little bit more about that when we get to it, and how we're kind of trying to implement this here in our county here in New York. But first, let me go ahead and introduce the Comprehensive Contraceptive Coverage Act, which has actually been in place since 2020. The interesting thing is this is something that kind of went under the radar, and very few people were finding know about it, which is why, despite it being implemented and at this point over 4 years ago, we are now deciding to educate and bring more awareness to this, because we're realizing how few people have known about this and are implementing it in their practice. So the Comprehensive Contraceptive Coverage Act does require coverage without deductible, co-insurance, co-payment, or any other cost-sharing requirements for covered contraceptives, including emergency contraception. So really what this does is this codifies a lot of what we've already seen with the Affordable Care Act, which was passed federally. So there's many states across the country that do have coverage with limited or no copays or deductibles because of the Affordable Care Act. But this gives us kind of an expansion here within New York State. It also requires coverage for a 12-month supply dispensed at one time to the insured. And that's really what we're going to focus on today, and has kind of been our focus with some of the projects that we've been doing recently related to the CCCA. It also prohibits any restrictions or delays on coverage, such as pre-authorization, step therapy protocols, or quantity limits on a 12-month supply or less. The way that this law is written is that there is, this not only is covered contraceptives that are prescribed, so our hormonal products and our products that have to have a prescription, but also emergency contraception, which is available over the counter, and as well, potentially our O-pill, which is our new OTC birth control pill as well. So there's a lot of opportunity with this bill, and a lot of it we are learning is not something that is being implemented. And so we're hoping to really kind of spread the word about that. The reason we have been focusing on the 12-month supply, and kind of the focus of this presentation here will be that 12-month supply of birth control, is because studies have shown that those who get a 12-month supply at one time are less likely to receive emergency contraception, less likely to have documentation of pregnancy, and are more likely to refill the prescription after 1 year. And for the pharmacists who are on, and the pharmacy students, you're familiar with the fact that we typically work in 30 and 90-day supplies in a pharmacy. It's very rare that we're going to see an insurance plan cover more than a 90-day supply of anything at one time. And so to some extent, I think we have pharmacists, providers, and patients all trained to expect, maybe a maximum of 90 days supply at a time. And so to be able to get a 12-month supply of something without a vacation override or without having to pay out of pocket for something is super new to us, and is actually, very interesting. But there have been studies that have looked at this specifically in the area of birth control, and we know that this really does remove that barrier of running out of pills on a Sunday, and, potentially having to go out and get some emergency contraception or potentially becoming pregnant. But unfortunately, despite the 4 years, over 4 years now in action, we're seeing some issues with that success. And that's why, based on some conversations that I've had with New York Birth Control Access Project, based on some conversations with others who are leaders in this field of reproductive health access, especially in the pharmacy arena, as well as local providers like Dr. Steinberg. We're really trying to get the word out about this and start to look at what some of those barriers are, because it's really not, it hasn't been taken up anecdotally from what we've seen. I myself work in a community pharmacy setting, a grocery store chain, and I really have very rarely seen 12-month supplies. I think maybe we've seen one in the years that I've been there. Every once in a while we'll get a 6-month that will come through. But we've also had incidences where we have prescriptions that show up for the larger amount, and individuals will automatically bring those back to a 3-month or a 1-month supply, just assuming they're not going to go through because of lack of knowledge about this. So we've kind of, started having discussions with the New York Birth Control Access Project, which prompted this webinar here to help try to make more people aware of this, so we can at least start spreading the word. And start hopefully identifying more of these barriers that are stopping this from being implemented. We're really seeing that prescribers are really unaware of this. As I reached out to Dr. Steinberg at the beginning of this year, he was not familiar with it, despite being super in tune, from my experience, to the reproductive health arena and public health in general in New York State. We have since reached out to most of our reproductive health care providers here in Broome County, and none of them were aware of it, but all, were in favor of it, but just not something that they were aware of. Pharmacies, many of the pharmacists that I work with, I'll pull students in class, and students haven't seen this going through. It hasn't been something on their radar. Patients just aren't aware of it to even ask for it. They're not, bringing it up to their providers. They're not pushing for it at the pharmacies. And then I think one of the bigger things that we're seeing that we'll talk about a little bit more specifically in relationship to the project that we have, this pilot project that we carried out, is third-party plans are unfortunately not complying with this. This was something that New York Birth Control Access Project did identify several years ago, including with Medicaid, which is usually pretty good at compliance pieces. And since then, we have seen Medicaid coverage being in compliance with the rules here. But we'll talk a little bit about how this has been, one of the bigger challenges here, as far as it being in insurance law in New York State, but not being covered. So again, just to clarify what this looks like, this is not a 1-month supply with 11 refills. This isn't a 3-month supply with 3 refills. This is a 12-month supply with 0 refills on it. So this should be 12 packs of birth control, or 4 packs of an extended cycle birth control, that's covered for an entire year. Really, the only place that we probably see this across the board for those you pharmacists who are dispensing is the Annovera vaginal ring, which can be used for an entire year. But otherwise, this is something that's fairly new to us. And, we rarely would have been asked to do this, besides maybe the rare individual who was studying abroad, traveling for a long period of time. And even then, vacation overrides may not have worked. They may have required out-of-pocket payment. So when we look at how that actually would be written for an individual, we have our birth control option here, take one daily, written for 12 packs with no refills. New York Birth Control Access Project actually has a great guide to this on their website. So if this is something that you're looking for, having a reference or being able to share with providers or even patients locally, I think this does a really nice job of kind of summing up what to do and explaining, what the expectation would be for coverage, and kind of how to navigate that if an individual is denied, how to approach a provider about it. So I think this document does a great job, and that is available on their website for those of you who are looking for additional resources. I'm going to hand it off to Dr. Steinberg now, who, again, I approached at the beginning of this year. with kind of a crazy idea to look into something. And he's going to give you kind of a quick overview of a project that we've been able to implement thanks to some very active medical students in our area.
Great, thank you, Sarah. And Sarah, I'll rely on you to push the slides forward since you've got control of that.
Absolutely. Just give me a notice.
Great. So I'm Josh Steinberg. I'm a family physician here in the Binghamton area. And I have an affiliation with SUNY Upstate Medical University and the Family Medicine Training Program here in Binghamton and Johnson City, New York. And I've been very active in women's healthcare, contraception, obstetrics, labor and delivery, all that stuff. And of course, I'm also interested and I care about process change because it's one thing to have a good idea, but it's quite a different thing to make it happen. So I was really amazed about the advocacy work that had already been done by New York Birth Control Action, and I thought we need to take the next step. They've done all the work, they've laid the groundwork for successfully changing and improving what we can do in New York State. And yet I'd never heard of it. And none of my colleagues have heard of the option of prescribing anything more than 1 month or 3 months of pretty much anything. So so this was a neat project. To do so, we needed to find a venue that wrote birth control prescriptions at higher volume than my personal practice does. And so we partnered with our great colleagues at Family Planning of South Central New York. They do all the great things that typical Planned Parenthood might do in many communities around the state. And this is the organization that we have for our region in several counties of the southern tier in the Binghamton area. So we went to them and they thought, this is a great idea. We've never heard of this. And as long as we get permission, we would love to try getting some prescriptions out there. And so all the approvals they needed to work with us were obtained. And so ever since about early July, their clinicians have been offering extended quantities of birth control prescriptions to those patients who are interested and excited about the offer. And it turns out that it's not been taken up by as many people as we thought. And we don't yet know whether that's because not every clinician made the offer or not every patient said yes. But so far in about 2 months, we've had 9 prescribing events for extended quantities of birth control pills. And as you can see, we've had a mixed bag of success. We're still waiting to find out the outcomes for a couple of our 9 prescribing events. But we've had 3 successes, and notably each was with Fidelis, which has the New York State Medicaid drug coverage contract. And it's good to see that the people who are doing New York State's prescribing and approvals and dispensing are following New York State's own laws. So that's a win. But lots of other commercial insurance has said no. And whether it was a request for 6 packs and 1 refill or 12 packs and no refills, in every other instance, there's been a denial and only a partial quantity has been dispensed. So that's what we've done so far, but we are hoping to continue this collaboration with Family Planning of South Central New York for probably another few months, because we'd like to get 20 or 30 prescriptions out there and then have some good feedback about what happens when you put them out in the world and what barriers we need to overcome to make this more standard of care and successful for the patients we serve.
Thank you for that summary. So yeah, so as you can see, we're kind of we were, I think, all very surprised, and we have like I mentioned, a nice team of medical students as well, who many of them had also not heard of it, but we're really excited and interested in kind of making this successful. And so it definitely has been a surprise to see the low numbers. One thing that we did in our project design was not record how many individuals were approached about it, because we didn't want that to be an additional burden on the providers we were asking to approach this. So it's a little unclear, do we have the providers kind of in such a mindset that they forget to make this offer? Perhaps they are allowing some of their thoughts and opinions to get in the, determine which patients they approach about this. So maybe if they believe a patient maybe is a little more flaky, or maybe more likely to lose a medication, or may not respond as well. All reasonable reasons to not go with a year's supply at a time. Maybe they aren't even offered it. Or is it the patients that are being offered it and then are saying, no, I don't want this, and what is the reason for that? So additional kind of detailed information would be helpful, but this has definitely been an interesting start and has helped us improve that research question. As far as our tips for success of things that we've identified so far, as a way that we can promote this, utilizing those New York Birth Control Access Project resources, like I said, it's fairly simple on the surface, but there are some great resources that can be shared with patients, providers, other pharmacists about the implementation of this and kind of what to expect. Keeping open lines of communications between providers and clinicians. So if you are a clinician, or if you know clinicians who are offering this, we'd recommend letting the popular pharmacies nearby know that you're offering this to patients. I think that's one thing that can help kind of smooth that process. And we actually had our medical students go into several of the common pharmacies that are used by patients at those clinics, just to kind of give the pharmacies a heads up that this was coming, to kind of keep an eye out for it, make sure they were aware of the rules. One thing we were concerned about was stock and inventory of the products, and that didn't seem to be a barrier for patients getting access, which was very nice to know. And as far as pharmacists go, letting clinicians know which barriers you're encountering when you're trying to fill these extended quantity prescriptions. The Attorney General actually does have, this is something that is a known issue in New York State, and so there actually is a web form to go ahead and file complaints against insurers related to non-coverage of this, and they have, I believe, fined at least one major insurer in the last year related to non-compliance with this. But it's tricky. It's hard to kind of play catch up with different plans. Obviously, individuals' plans change, and it's hard to stay on top of that. But if you see this information, and if you have a situation where you really feel like this was a situation where the patient, their insurance was not complying, there is a way to report that, so that the Attorney General can be looking into this. We've had a few frequently asked questions come up, and some of these have come from conversations I've had with Dr. Steinberg. Some of them have come just from our internal conversations in New York Birth Control Access Project. Our medical students brought up some of these great questions as well. So these are probably some common ones that I see related to needing to change their birth control or losing a pack of birth control when they have these large cycles. As far as the first one goes, for providers, I think it's probably a good idea to make sure a patient is, comfortable and it is used to using that certain product before going ahead with that year-long supply of something. A year-long supply would probably not be appropriate for a patient newly starting a product or switching a product. A trial of 1 or 3 month supply at a time would be appropriate, and then going ahead with the 1 year once that patient was stable on that certain birth control. As far as losing a pack of birth control, we see lost medications all the time at the pharmacy. Obviously, it becomes a bigger deal maybe when it's more birth control, or more packages or a larger amount, but most insurance plans do have overrides available if a product is lost, or the prescriber can adjust the medication slightly so that a new product would be covered. Obviously, this could affect a pharmacy's inventory. I think in most cases, many of us, have our patients very used to the fact that if we don't have a product in stock, we can order it in the next day or a few days later. And I think that that would probably be something that would be employed often in this case. However, waiting a few days and then not having to come back to the pharmacy for a year versus, being able to get a 1 month today, but having to come in every 4 weeks may be preferable to a lot of patients. One thing that we've also seen kind of since the passage of this law has been the new OTC birth control product, Opill. So hopefully you guys have seen this on the shelves at your pharmacies. Hopefully you've seen some uptake with that. Obviously, in this case, Opill is going to be OTC versus these are for prescription products. So if the provider wanted to write it for a full month supply, they could go ahead with a prescription product. Technically, CCCA, the way that it's written should cover some OTC products. That's something that New York Birth Control Access Project is actually really looking into right now, the coverage of over-the-counter products like Opill, Plan B, and even condoms, and how those would be covered when the law says that it should cover all products, including OTC products, without any cost sharing. Right now, you wouldn't be able to just grab a product from the shelf, bring your insurance to the pharmacy, and have it covered. But technically, the way the law is written, it should allow for that. So that's a conversation that we've been having recently with New York Birth Control Access Project, some of their legal individuals who advise on legal aspects as well, to kind of see how that could be utilized to help cover some of those products, because that's been something that's been raised as far as being a barrier to accessing the OTC products. They are decently expensive for a month's supply. As far as all patients being dispensed a 12-month supply, I think we can confirm that, this is a very patient-centered decision, and it should be something that the patient and provider discuss. It's not going to be appropriate for everyone. There's individuals who don't want to be responsible for a 12-month supply at a time. There's those who may not have the space to store that, or the ability to manage that. And that's, completely appropriate. It's not something that should be pushed on every patient, but it should be offered as an option if appropriate. And then as far as what if the patient's insurance won't cover a 12-month supply, again, this is something that we would expect based on compliance with New York state law. And so obviously in the moment, we can't make any changes, but the patient should be encouraged to reach out to their insurance company. If you're a pharmacist who happens to have extra time, I know that right now in the height of flu season, that's not something many of us have. Making that call yourself to kind of try to weed through the different phone queues to see if you can get someone. That's again how it was sorted out with New York State Medicaid. But also using that Attorney General reporting form if you want to, just make a quick claim there.